So I'm Kistien Monkhouse. I am the founder and CEO of Patient Orator, but more importantly, I am someone who advocates for health and well-being for every person. And whether that is that they classify themselves as patients or just Americans or just citizens of the world that want to be treated equally in their healthcare encounters, I'm here to help empower those voices and to ensure that everyone is treated fairly.
You know, I've met you and been a big fan of yours for a while now, and the way that you talk about the inequities that happen in health around the world, you say it with such conviction and passion. That obviously comes from a place of your own personal experience. Can you take us through kind of what inspired you to take on this path of advocacy?
Sure. It didn't come from a personal space. It actually came from witnessing firsthand on the front lines that people were not being treated equally. So I started out in advocacy because I was a nursing assistant while pursuing my degree in public health. And while I worked the night shifts, one of the things that I was seeing was that people of color and people of lower income were being readmitted into hospital systems a week or so after being discharged, and questioned why that was. So with my policy expertise that I was building during the day as I was pursuing my education, I understood that policy actually plays a very intimate role into what people's health outcomes are. But more so in speaking to patients, one of the things that I was hearing directly was that they felt as though they were being invalidated because their voices were not being heard by the people on the front lines. And as someone who was on the front lines, who was very intentional about taking that time to chat with that person, to learn about who they are, where they come from, what their in-home situation was, started looking at this problem from a systemic standpoint. So looking within the hospital system itself from an organizational standpoint, what were the barriers that were preventing people who were on the delivery end from actually interacting with these patients in a humanistic way. And I saw a lot of that as being an administrative burden. So there was a lot of friction within even the care delivery team and how information is passed back and forth, how limited a clinician may be in the time they spend with a patient, in the way information move from one system to another, and so many other barriers. Of course, as a patient and people that are in dire need of care, they're not seeing that. What they're seeing is someone who is being very short with them, who's not providing enough time or attention or even eye contact or being humanistic. And so one of the things that I learned was in speaking to people across races, Black and white and brown and everyone, people just want to be heard. People want to be treated equally. And there's something so amazingly human about healthcare. But I was having these amazing conversations with humans. It didn't matter what the color of their skin were. And I just kept hearing, like, we feel as though our voices are not being heard. And I thought, oh, how powerful could it be if we are having this conversation on a collective level, publicly, that we're talking about the fact that our healthcare system doesn't serve us. I thought that if I could do that and help shift the paradigm in that way, to create conversation around healthcare delivery, to bring awareness to poor patient experience, to bring awareness to healthcare disparity, then we can make change. Of course, the change that I wanted to create initially was not amplified in the way that I had sought out for it to be amplified, because at the time, I believe that people really weren't incentivized, so to speak, to address healthcare disparity or to address poor patient experience, because in the United States, system models doesn't necessarily support those types of care delivery. So those are some things that provoked me into the work of advocacy. And from the moment I started through video blogging and distributing content by a patient orator, I never looked back. And continuously I'm doing this work as a way to pave the way for the next generation of people, not me, but maybe my children or my grandchildren, or maybe it's not even my immediate family. It could be strangers just the next generation of humans should have a better healthcare system. And that's why I continue to do the work that I'm doing.
And I spoke to an incredibly reputable oncologist recently, and we were talking about access to medicine more broadly around the world. And he goes, is it access or is it equity? Because he said the average Joe walking in the street will find it hard to navigate and access the best and the best healthcare. But someone with money can access what they want when they want. So health equity, like, what are the driving forces of the inequity in the health system that you've seen?
So this is a very, very thoughtful and tough question. Of course, with my policy background, I kind of look at things through that lens of policy, right? And if we have policy to protect people, to foster good health, then we won't have this conversation about healthcare disparity or even health inequity. So if we look at what the driving forces are to poor health outcomes, it goes back to social determinants of health. And that is a healthcare-centric language, but let's break that down. What social determinants of health means is that where a person lives, their education, their immediate environment, those are all things that impact directly their ability to obtain or achieve their optimal health. And if those systems aren't in place, for example, if a person is housing insecure or they're food insecure, if they don't have a stable source of income, if their environment, isn't walkable, for example, or if their environment is unsafe, these things will actually hinder their ability to live optimally from a health standpoint. So if we think about what these issues are, even a step deeper, what are the policies in the places where people have the poorest health outcome as to why they are having these poor health outcomes? So if we look at the issue of environment, for example, if we're talking about safe spaces where a person can walk, sidewalks, for example, or even the fact that you have to drive to get to a destination, right? And we break that down even further, the issue of obesity, for example, right? Or the ability to access fresh foods from either a monetary standpoint or being able to get to that place where that grocery can be obtained easily. These are all policy issues. No matter which way you turn it, policy influence directly all of those issues.
And it was the same oncologist that said to me, and I said, if I kind of call myself that hybrid of, well, I did. Now I'm more entrepreneur than I am, but I was kind of that advocate and activist, because I really didn't just want to share my story and the issues. I wanted to try and help solve them. And that led me to upskilling myself, spending time in America, listening to different communities, the Latino community, people of color, like everyone, and hear their stories. And it really did come down to some of the basic human rights that a lot of people take for granted. You can't have good health if you don't have some of the most basic fundamental things that we privileged people take for granted. Like, I come from a predominantly Caucasian community in Australia. I have free healthcare. I have everything available, fresh food, safe location. And it wasn't until I actually got myself out of my comfort zone and listened to those uncomfortable truths that I went, wow, the world is not that easy for everyone. It's actually hard for the majority of people. How can advocates turn their advocacy away from themselves and focus on something bigger like policy? Because it seems to be, it is a complicated thing to do to affect policy change. where do you start? Like as an advocate or as a patient or someone that wants to do something, where do you start? I'll have one too.
So sorry about that. Where do you start as an advocate? For me, I really started my journey in advocacy from a selfless place. Like I truly and s- want to change the world. Like that is so core about who I am. And it angers me that there's not enough support for people like me, because I dare people to imagine if there's all of this change or people that want to create change, that are being empowered in the work that they do. Like imagine the difference that could be made, but that's not the world that we live in. So until then, I think that if we can provoke thought, if we can ignite each other, just as human beings, it doesn't matter whether your illness is specific to this category and you're advocating for this specific issue. If you can mobilize your community to become a voice, to be heard, and there's such great strength in numbers, right? So it doesn't have to be as complicated as showing up at Parliament or advocating in that particular way. But there's so much mobility that can happen on social media, for example. And I talk about this idea of being active participants in your health. That extends beyond just healthcare itself. That extends to where you live, right? What is being offered in your community, for example? Who are the people outside of that community that doesn't have the same luxuries as you do? And how can you support their mission? You know, I spoke earlier about the fact that I started this work understanding that there's so much goodness in humans, that we're all suffering in some way or another, but we're not talking to each other. That's why I was provoked to start the work that I started in video blogging and in advocacy. So if this makes any sense at all, I think if we can start reaching outside of ourselves, reaching out to the communities that are nearest, whether that means in proximity or whether that means in experience, and start talking about ways in which we could bridge gaps that each community face respectively. I think that's easy ways and easy steps in which we can combat some of these bigger issues. But baby steps, grassroots, always can make a difference.
With the the Black community, obviously there has been generations of them kind of being able to access health education. How much of an impact does that have on health outcomes? I know we can talk kind of about humans and about equality more broadly, but when you've had kind of the constant systemic challenges that has been faced like generation upon generation, when you look at the data, it is that community of people have some of the poorest health outcomes. And I know we're talking about that how can you have good health outcomes when even some of the most basic provisions for life are compromised? What can we do, like as privileged people, as healthcare industry, as I know it's the policy, but for people, is it about investing in those communities? Is it about what can we do?
I think it's again, this is very complex, and like I don't think I have the solution for this or the expertise to say, okay, this is the end all be all solution. But I think investment is needed. You have to invest in communities of color because if we look at this issue of equity or inequity, it's really a lack of access. So if you can drive resources to these communities that need it the most, then we can really be uplifting these communities or empowering them to achieve health in a way that they might have not been able to before. On the other part of that, and this kind of ties in, is the research, right? So are we funding enough research in areas where traditionally have not been funded? And secondly, how are we collaborating with these communities? Are we looking just to use people's voices? Are we using to manipulate the situation for sensationalism or for any other reason that is not morally, a part of progressing healthcare, health outcomes? There's also more to do with this issue of distress in African American communities, or distress, I should say, where because of all of this trauma that we've endured, and this is not specific to the United States, this is across the globe, uh, being on the receiving end of trauma historically, that does something to any kind of person, people, or population. Yeah, and so while it's great that everyone wants to be helpful and help communities of color, especially African American communities, we have to be mindful of how we engage with these communities. We have to absolutely partner with people who are at the grassroots level, like I mentioned before. How do we activate these communities is really by going to the communities and asking, like, how can we be productive allies together, as opposed to this more patriarchal way of saying, hey, we know what the solution are. I think there has to be like a communicative way of collaborating and partnering with communities of color, keeping in mind the historical context of all of the issues that has happened to these groups.
So obviously we're seeing kind of a lot of complex problems happening around the world with COVID. What are some of your concerns in the work that you do, especially around COVID and cancer and screening and people not engaging with health? Are you concerned?
Of course. I think across the board, we're all suffering or concerned in one way or another about what COVID is doing to our communities. And in some communities are more damaged than others. For example, the African American communities here in the United States, disproportionately impacted by COVID-19. I think that, like, one of the issues that I don't think people are talking about a lot is people that are delaying care, right? Because if it's not safe for someone to go into their traditional healthcare place, that the traditional place in which they receive healthcare, that might hinder or may cause them to not seek out care, and that might have lasting impact or poor health outcome eventually. And so if we look at that from a larger scale, from like hundreds of people delaying care, like what will that impact be? So that's something that we have to keep in the back of our minds. How do we continue to deliver care, especially during this time? Help people to understand that what they're going through is a lot from like a mental health standpoint. And there's so many other things. And I've been working on an app that helps people to document, their medical conditions or changes in their medical conditions. And that's one of the things in which this app seeks to solve, which is that while people aren't being seen, to help them keep accountability of these issues, their health issues specifically, so that when they're communicating with their medical doctor, they can have the information that they need to achieve or receive optimal health.
Do you have hope for the future with health equity? For the immediate future, for the long-term future?
Of course. I think that we all, as advocates, do this work because we are seeking to create change. I wouldn't be doing something that I didn't feel could potentially change. I started advocating in that space of health equity, creating conversations with policy and patients and advocates and all of these different people, because I understand that together, like, there's this human-centeredness around wanting change. for this problem that we're all seeking, which is a dehumanized healthcare system, right? And so I'm hopeful for the future. I'm hopeful for everyone being able to receive equitable health. Or let me restate that. I'm hopeful that everyone will be able to receive health equitably. And so that's why I continue to do the work that I do. But I also understand that it is challenging, either from a personal standpoint as an advocate, or from groups of people who want to see this change, but it's not happening fast enough. So I think now we're in that space of how do we create that change, and how do we like really start working towards that? So baby steps.
Oh, if people want to find you, where can they find you?
Sure. So you can learn about the work of Patient Orator at patientorator.com. We're also on social media at Patient Orator, PATIENTORATOR. You can find me across the internet at Kistien Monkhouse. I'm on LinkedIn, and Kistien M, Kistien M, on Twitter.
Awesome. Thank you so much, as always, for your incredible, enlightening conversations that will get everyone thinking about the true changing face of healthcare around the world, and the work that needs to be done to ensure, like you said, equitable and timely access for all humans. I think is the message that I took away from this, Kistien, is you genuinely care about all humans and want to make a lasting difference to the next generation and the one after that. So thank you for getting up early for me. You're amazing. Thank you.
Thank you, Krystal. I'm truly honored to have been invited, and continue doing the work that you're doing also. Yeah, I believe that we can all achieve health equity and empower the voices of people that needs to be heard. So thank you for having me.